Hello everyone, I'm Dr. Karen Saldanha, Specialist Pediatrics from Aster Clinic, Business Bay branch. Influenza. Influenza virus is an acute respiratory tract infection characterized by fever with chills, body pain. It will have stuffed nose, sore throat, headache, tiredness, and in some children it can cause abdominal pain and vomiting. So, what is influenza virus? So, influenza virus has two types. One is influenza A and B, which is seasonal, which occurs around month of October to March, and influenza C, which is in mild cases. So, when does influenza virus become contagious? Influenza virus become contagious 1 day prior to the symptoms and 4 days after the patient has developed symptoms. So who are the patients who are high risk for influenza virus? Adults who are more than 65 years, children who are less than 2 years old, children or adults who are obese with a BMI more than 40, patients who have had stroke, people who are having chronic conditions like chronic lung diseases like COPD, cystic fibrosis, chronic heart conditions like coronary artery diseases, patients with blood disorders like sickle cell anemia, patients who are immunocompromised like having cancer or HIV, which they are on chemotherapy, and patients who are pregnant mothers also are at risk, and the hospital staff like the healthcare providers who are in the like nurses, doctors, as well as the school-going children. About the vaccine. Influenza vaccine is a quadrivalent vaccine. It's prepared against two influenza A strains, which is H1N1 and H3N2, and two influenza B strains, Victoria and Yamagata. Who are the people who need to get vaccinated? Everyone above 6 months old need to be vaccinated up to adulthood. So 6 months to 9 years, if a person is vaccinated for the first time, they have to take 2 vaccines with 1 month apart. If they are above 9 years, then they'll have to take 1 vaccine, a single dose of vaccine every year. So now, who are the people who are contraindicated for taking vaccines? One is the children or the adults who are severe egg allergic, who come to the hospital setting needing anti-allergic medications like intramuscular injections like epinephrine, or who are having allergic to vaccine component, or children or adults who have had Guillain-Barré syndrome less than 6 weeks after taking the vaccine, blood disorders like sickle cell anemia. These are the people who should be contraindicated in taking the vaccine. So a lot of people have doubts regarding COVID-19 virus and influenza virus. So let me tell you the similarities. COVID-19 virus, the symptoms of that, it develops 5 days after the person has been infected, or 2 to 14 days after the person has been infected. But in influenza virus, they get infected 1 to 4 days after the virus they have contracted. And when it comes to contagious, in COVID-19 patients, they will be contagious 2 days prior to the virus and 10 days after the infection. And in influenza virus, they will be infected 1 day before the infection and 4 days, sometimes up to 7 days after the infection. So, when do we take the vaccine? COVID-19 vaccine and influenza vaccine, the flu shot, can be taken at the same day. Also, some people have doubts, if we take COVID-19 vaccine, the first dose, and we are waiting for the second dose, can we take the flu shot? Yes, you can take the flu shot. Yeah, so now there are some preventive measures which I will tell you, just general measures how to avoid these infection is by avoid overcrowding. Wash your hands regularly before and after eating your food or using the toilet, like wash your hands with hand and soap for minimum of 20 seconds. If you don't have soap, you can use the hand sanitizer with 60% alcohol, and also avoid overcrowding. That is how you can prevent yourself and other people in your surroundings. Thank you. We will treat you well.